Hi all, it's Malia Jones from Dear Pandemic and UW-Madison's Applied Population Laboratory. And I'm here today to talk to you about individual risk in your activities and community level risk. We get a lot of questions at Dear Pandemic that go along the lines of, what is my risk in XYZ situation? These questions are really hard to answer because individual level risk and community level risk are related to one another. And we don't know much about your community level risk, even when you tell us what activities you're going to engage in at the individual level. And as it turns out, in a whole population of people who are engaged in low risk activities, you can still have community transmission and high community level risk of an outbreak. So along with colleagues at APL, I developed this simulation called COVID Crush. This is a toy model of disease transmission, and it's meant to help you think through how individual level decisions can scale up to community level patterns. And so you can actually go to this and play with it yourself at the URL apl.wisc.edu/COVID. The model works like this. There's a population of 1,000 dots, and every time we restart the model, one dot is infected with a disease that's similar to COVID-19 in terms of disease transmission timeline. These dots are going to start to move around the screen, and when they bump into one another, they can give each other the disease. And so in this really basic model, you'll see the dots start bumping around into one another, and when they bump into one another, they give each other disease. And you can see the disease spreading through the population. Now, you can play with the parameters of this model to show how social distancing measures can alter the course of the disease spreading through the population. So I'm going to just pause the model. I'm going to turn on social distancing. And then I'm going to allow some of the people in the model to engage in this low risk activity at the individual level, which is to visit their neighbors. So we'll have 10% of people who are visiting with a few of their neighbors in this new model. And what we'll see here is that when the model begins, everybody went to their home. 90% of the people stay in their home, so they're completely isolated from the rest of the population. But 10% of people engage in this individual level, pretty low risk activity, which is to visit some of their neighbors. And you can see those dots moving back and forth from household to household. And what we observe when we run this model is that even though everybody's individual level behaviors are pretty low risk, it's still very easy for the disease to spread through a large part of the population. And so when we're asked about what's my individual level risk in XYZ activity, it can be really hard for us to answer because first, we don't know how much disease is circulating in your community. And second, even those low risk activities can contribute to the disease continuing to spread and causing a real spike in cases. So as you can see, even with those individual level low risk activities going on, we had 71% of our population infected at the end of 1 month. So I hope that has answered some of the questions that you didn't ask about what your individual level risk is and illustrate what the community level risks of your individual behaviors might be. And that those will help inform your decisions as you go forward into your weekend. If you want to play with the model yourself, you can go to apl.wisc.edu/COVID. Have a great weekend.